Maxillary occlusal radiograph cross-sectional view. The film is positioned with the right side facing the arch that is being exposed. The film is placed in the mouth between the occlusal surfaces of the maxillary and mandibular teeth, and it is pushed gently backwards until it contacts the anterior border of the rami. It is stabilized when the patient gently bites on the surface of the film. The patient head must be positioned such that the upper arch is parallel to the floor and the mid-sagittal plane is perpendicular to the floor. The central ray is directed at an horizontal angulation of 0 degree and vertical angulation of plus 65 degree. The PID is positioned in such a way that the central ray enters the patient's face through the bridge of the nose. This projection shows the palate, the zygomatic process of the maxilla, the antero-inferior aspects of the each antrum, nasolacrimal canal, teeth from the right second molar to the left second molar, and the nasal septum. Exposure time for occlusal radiographs is 0.32 seconds. This projection shows the maxillary sinus, nasal septum, lateral wall of nasal fossa, and the teeth from the right second molar to the left second molar. Maxillary occlusal radiograph topographic view anterior. The film is positioned with the right side facing the maxilla, and it is placed in the mouth between the occlusal surfaces of the maxillary and mandibular teeth. It is pushed backwards until it contacts the anterior border of the rami, and it is stabilized when the patient gently bites on the surface of the film. The patient's head must be positioned so that the upper arch is parallel to the floor and mid-sagittal plane is perpendicular to the floor. The horizontal angulation of plus 0 degree and vertical angulation of plus 45 degree has to be given. The PID is positioned such a way that the central ray enters the patient's face through the tip of the nose. The primary field of this projection includes the anterior maxilla and its dentition. It also includes the anterior floor of the nasal fossa and the teeth from canine to canine. Exposure time is 0.32 seconds. This projection shows the nasal septum, lateral wall of nasal fossa, anterior nasal spine, nasopalatine foramen, nasal fossa, and the teeth from canine to canine. Maxillary occlusal radiograph topographic view lateral. The film is placed with its long axis parallel to the sagittal plane, and it is pushed towards the side of interest. The lateral border should be positioned parallel to the buccal surfaces of the posterior teeth. The film is stabilized when the patient gently bites on the surface of the film. The patient's head must be positioned such that the upper arch is parallel to the floor and mid-sagittal plane is perpendicular to the floor. Then vertical angulation of plus 60 degree has to be given. The PID is positioned such a way that the central ray is projected to a point 2 cm below the lateral canthus of the eye. This projection shows half of the alveolar ridge of the maxilla, infralateral aspect of the antrum, the tuberosity, and the teeth from the lateral incisors to the third molar. It may also show the zygomatic process of the maxilla superimposed with the roots of the molar tooth. Exposure time is 0.32 seconds. Shows the floor of nasal cavity, floor of maxillary sinus, zygomatic process superimposed with the roots of the molar teeth, teeth from lateral incisors to third molar.